So my doctor says I have osteoporosis and wants to put me on a medication, but says, by the way, this medication may cause an unusual kind of fracture. And I'm like, why on earth would I do that? My name is Dr. Arinola Dada. I'm a rheumatologist. I help people with joint pain become pain-free, and people who have autoimmune diseases get their immune system back on track. Let's talk about this. So what I just said is a story I hear very frequently from my patients. They come in and they're like, you need to help me. This doctor wants to put me on this medicine, and she tells me that the side effect of this medicine is that I can break a bone. They're like, what the heck? Okay, so let's calm down, let's pull it back, and let's dissect it. So your doctor is right. There is a medication that can reduce the risk of fractures by 50%, actually at least by 50%, right? But then if you take it for too long, there's a possibility that your bones kind of freeze up and that you may have these atypical fractures of the hip. So this is how I break it down for my patients, okay? So we know that if your bones are thin, there's a risk that you can break something. For instance, you could be walking on the carpet, slip, fall, and break something because the bones are fragile. Your doctor does a bone density test to try to predict whether you are indeed going to be at risk for a fracture. Other things that can happen when one has really fragile bone is one can cough and break a vertebrae. That is how fragile the bones can be, that they can break. So this is what I tell my patients, okay? Yes, it is possible that if you take the medications for more than 10 years, that the bones freeze. But what does that mean? Why would bones even freeze? Well, so your bone is alive, okay? And your bone isn't like a concrete block, right? Your bone is actually like a lattice, right? Of basically different intersected cellular structures, right? That allows you to have what's called tensile strength, right? So when you sway, you don't crack something. Like, you know, if you have a concrete building, there's really not a lot of sway. So bone is made by bone builders, osteoblast, B for builder, B for Bob the builder, and osteoclasts, which go in there and they clean up all the extra bone, but they also get rid of bones. And so that's why when you look at the bone architecture, it looks like it has like little, like you can see through it. If you can see through it a lot, then there's probably osteoporosis. But if you can see through a little bit, that's kind of what the lacing of the structure of the bone is. So anyway, back to the story. We have osteoblasts that are bone builders and osteoclasts that are like Pac-Man, and they're bone destroyers. So the medications have to do one of two things. Either they help to build the bone like bone builders, or they destroy or they slow down the bone cutters, the osteoclasts. So either you have more builders or you have less cutters. Like, kind of like, but what happens if you have the patients on medication for a while? Well, let's say all the bone builders are doing all the work and they're not getting any feedback from the bone cutters. So what happens then is the bone builders kind of act like my kids and they say, why am I doing all the work around here? And then they stop, right? So there's a feedback loop between the bone builders and the bone cutters. And if the bone builders are the only ones doing all the work and the bone cutters aren't doing anything, the bone builders also stop. And if the bone builders and the bone cutters stop, then you can have a situation where the bone freezes, and then people may be prone to these atypical hip fractures. Now, solution to problem. The recommendations from all the different societies is don't give the patient the medication for more than 10 years. Now, this does not apply to all medications, I'm going to say. It applies specifically to medications that are called bisphosphonates, right? And those are medications that those are kind of the first to market. And so those are for medications called bisphosphonates. There are other medications that are useful for people that have low bone density, and we're not talking about those today, just this medication is called bisphosphonates, right? So they're the oldest, they're the most commonly used. They also come in free pills or in intravenous form. So basically what I'm telling you is talk to your doctor. When your doctor says, hey, there's this medication I want you to take, just have a conversation. Don't just run screaming from the room because you heard that this medication can also cause an atypical hip fracture. So bottom line, those medications improve bone density and reduce the risk of fracture. And the studies have shown that they reduce the risk of fracture by 50% in a few years, right? So it takes time to build bone, so it's not an overnight sensation, but stick in there with your doctor. Ask questions, let your doctor know what concerns you have. So my name is Dr. Arinola Dada. If you think this video has been helpful, please share it, like it, and subscribe to our channel. If you are in the greater Seattle area, look us up at overlakearthritis.com. Thank you. Have a wonderful year. Bye.